All right.
Good day and welcome to another episode of Fertility Solutions Fertility Talk. And today we've got Professor Kruger, and he's from Aevitas Fertility Clinic. And they're out in Pinelands. Thank you and welcome, Professor.
Yeah, thank you very much. It's a privilege always to talk to you guys. So I'm looking forward to the interaction.
Thank you. So today we're talking about men's health. It is Movember. So we are focusing a lot on men's health. And we're starting with Professor. The first question is, what are the most common causes of male infertility and how can they be diagnosed?
Yeah, we diagnose male fertility problems, of course, with a history, but that doesn't give you the answers. Your answer is in the semen analysis.
Yes.
So you must do a semen test, and then you get a good picture of what's going on. So I'm going to go through the semen analysis quickly so that the audience can understand what we are looking at. So everybody knows that we are looking at the count,
Yes.
the number of sperm. We are looking at movement. We are looking at the morphology. That means the shape of the sperm. And in your mind's eye, you must see the ideal form, the healthy sperm looking like an acorn. In Afrikaans is a akker, that
Okay.
shape,
Yes.
oval shape. If it's very misshapen, it is very abnormal. So we talk about the percentage normal forms, and that is the morphology. And then we look at MAR test, MAR. That is an antibody test. So some men can get an injury to the testis or previous operation, and then they develop antibodies against their own sperm, and then the sperm can't swim because of the antibodies. So basically, those are important points in the semen. But you must also look in the semen for infection. It's not sexually transmitted, but certain germs can affect the fertility. So I'm going, and then, of course, with the semen test, sometimes you find no sperm and no count, and that's called azoospermia. So your question was, what is the most common finding? That doesn't mean the male is infertile, but common finding that you fall in the lower fertility group, that there can be a problem. And the most common abnormality in 25% of men getting a semen test is the shape of the sperm is wrong. So
Mm.
the shape is too low, and we're talking about three categories on morphology or shape. 0 to 4% of those ideal forms, or 5 to 14%, or above 14. So if there's above 14% normal forms, then that guy can play for the Springboks. But if between 5 and 14, the chances are still good that he can score a try. But if it's 0 to 4, there's a lower chance. But none of these guys, you cannot say it's infertile. You say subfertile, and you need to give attention to why. So I'm answering then your first question, and I will reflect on the whys later on because I think there is a question like that.
Okay, thank you. Thank you very much, Professor. The next question is, can age affect male fertility? And if so, how does it influence sperm quality over time?
So you remember the famous man Christian Barnard.
Yes.
So he had a few wives, and he did impregnate them when he was much older. So the sperm count goes down in the male slowly, but it's not like the female, where the female goes into menopause.
Yeah.
So, but this fertility at age 60 will be lower than at age 30 theoretically, but that male can still impregnate women.
Okay. And what are the best practices for men to improve or maintain their fertility, especially if they plan to conceive later in life?
Yeah. So I'm giving you a list of things. First of all, a good lifestyle.
Mm.
Many men do not live a healthy life because they smoke. So don't smoke. You damage your sperm. In spite of the fact that you see many people smoking and still have kids, but if you battle, it's one of the things that one must absolutely take out of the equation. So I'm saying don't smoke.
Mm.
Second, if you drink more than 4 drinks at a given time, it kills the sperm. It affects the sperm. So that's called binge drinking. So one can drink a beer or two, but if you go beyond 4, you are affecting your sperm. Now, sperm takes 70 to 90 days to recover. Now, this weekend, I'm back to the Springboks. They've played. Now you drink 6 beers. Next week they play England. You drink again, you drink 6 beers or 8. You are affecting your fertility and it will take months to recover. So, yes, you can take a drink or two, maximum 3, and that's it. That is to adhere to your question. Then there are men going to gym and they want big muscles and they take androgens, uh, anabolic steroids. They get it there in the gyms. Very bad. And with respect, the bigger the muscles, the smaller the sperm count, or most of the times 0. So one must be very aware of anabolic steroids. Then
Mm.
the other one affecting your chances, dagga, marijuana, not good, not healthy. Whatever they say about marijuana, it is not good for fertility. So there are things in your hand that you can do. The male can also make sure that his weight is good because an overweight female and an overweight male affects on both sides the fertility. And there's very good studies showing if you lose weight and you get to a normal weight, the sexual function will increase, the quality of sperm will increase, and the fertility will increase. So overweight is a problem.
Okay, thank you very much, Professor. Our next question is, what are some effective treatment options available for men with fertility issues today?
Yeah, so I think again, want to repeat, and that is lifestyle, lifestyle, lifestyle. You can treat yourself by having a good lifestyle. Second, if there is a certain low count, for example, the doctor will do blood test, and certain men can benefit from a special hormonal treatment that is not expensive but
Mm.
can stimulate the brain to make contact with the testes and make better and more sperm. So treatment, medical treatment is possible. Vitamin supplements, and you can write it down, that vitamin C, zinc, and folic acid, very healthy for sperm, and they can take, let's say, 300 milligrams of vitamin C as a supplement, 5 milligrams folic acid that females must also take for prevention of spina bifida, but it's not their vitamin, it's our vitamin. So take it back, men. Take
Mm.
your folic acid and zinc 40 milligrams a day. That is the correct amounts, and you can easily talk to your pharmacist about that. There's also a product called Sperm Proof that's got exactly the same in. You can make your own if you want to.
And thank you very much. That's really great advice there, Professor. Our next question is, what are some common myths or misconceptions about male fertility?
Yeah, I think many times misconceptions are that it is the female that is the culprit and not the male, and in 50% of cases it will be male and female, so half half. And I think there's this still myth also from ages ago from the Egyptian times that it is the female not falling pregnant. But of course, there's a big role that the male is playing. And then I say it the third or fourth time now, lifestyle. Make sure that that is on your side, because you can immediately, within 60 days, affect your fertility and improve your fertility.
Yeah.
So I also think there's this misconception that people think they can drink and smoke, and that will not affect their fertility. Not true. And I think there's a list of other things, but perhaps this is enough.
Yeah. Thank you very much. Our last question is, how successful are assisted reproductive technologies, which are like IVF or ICSI for men with fertility issues?
Yeah. Let's say it's a very severe problem.
Yeah.
So severe that you can only find sperm in the testes. So you
Mm.
must take a small biopsy of the testes, and you take the sperm out, and they can move, but you can't do inseminations with them. You can only inject them in the egg,
Mm.
and that's called ICSI. So in those severe cases where the male comes with azoospermia, no sperm, and
Yeah.
now you find the sperm, you freeze it, and you use it on the female by injecting her eggs, very successful with a 60, 70% chance, dependent on the age of the female. So
Yeah.
if she's below 30, the pregnancy rate can be 60% plus, even in the most severe cases where last week they had zero chance because they had zero sperm.
Yeah.
Now the sperm is in the lab, and then you can help them at a very high rate.
Okay. Thank you very much. And even if I may ask, even if they've
Yes.
been sterilized, someone's been
Hmm.
sterilized, and are they still, is there still a chance for you to be able to get sperm?
Yeah, very good point. If someone is sterilized even longer than 15 years,
Mm.
and because there was this rule of 10 years,
Mm.
you can reconnect the tube, reanastomose. So you take the two tubules that's now away from each other and under microscope with a correct urologist.
Yeah.
Very important. Not every urologist is good with this. So you must find in the city, there are in our city at least two that is very good with connecting. But you connect when this man married a young woman. So if she's 30, 35, or younger as 30, you can consider connecting, because then they can fall pregnant on their own.
Wow.
If she is now 38, it's not worth your while connecting, but
Mm.
then you take a testis biopsy, and you do assisted reproduction, you do ICSI. So you
Yeah.
take the sperm, freeze it, and use it in the lab for ICSI. So they have options, and the age of the female playing a very important
Yeah.
role in the decision what to do.
Thank you. Thank you very much for that, Professor. I really
Welcome.
appreciate your time that you came to this.
Yeah.
Professor
I,
Kruger, sorry.
No, I appreciate again the invitation. It's always nice to speak to listeners, and I think you are trying to give very good facts to the listener, which is fantastic, because without facts, we
Yeah.
cannot make decisions.
Absolutely. Thank you very much. So Professor Kruger is at Aevitas Fertility Clinic. And if you want to get hold of him, you're welcome to contact them through, you can go to their website, aevitasfertilityclinic.co.za. And then there's also, you can go, you can contact them if you, on our website as well, Fertility Solutions website, or you can even find them on Instagram and on Facebook as well. You're welcome to contact them. So thank you very much, Professor. It's
Welcome.
been an
Welcome.
absolute pleasure talking to you. Thank you
Have a
very
good
much.
day.
You too.
Thank
Bye.
you.
Bye.
Goodbye.